Hello and welcome back. Let's go across to Dr. Hiren now. He's the Group CEO at Surya Hospital. He's now joining us. Sir, firstly, let's just talk about, the third wave and what's really happening in. Say if you are a customer and you've got tested positive. How should one react? Should one get panic? What should one do? Should one start to, monitor oxygen, take other medicines? What's the first protocol?
Good afternoon here. But see, the thing is, this wave which you are seeing currently is a much milder wave than the ones, or the virulence is much milder than the ones which you had seen earlier. So if you do get the symptoms, and believe me, you are very likely to get it very soon if you're not already got it. So in that situation, there's no need to panic. Just take symptomatic treatment and monitor your vitals. By vitals, I mean only your oxygenation and your temperature and pulse. And if they are within acceptable limits, if the fever is not very high, just keep on taking normal medications for it and you should be all right. This wave is not affecting the lungs as the previous waves, so the oxygenation is not dropping. However, we are seeing two subgroups in this particular variant. One in which it starts with fever and it typically rises up to 101, 102 almost. And the fever lasts for about 3 to 4 days. Taken only symptomatic treatment of paracetamol and supporting vitamins and nutrients, you are absolutely fine. And the other one is of a cough, like a running nose, cough, body ache. Both the things get body ache over here. And that you again take only the cough syrup and it's fine. All these patients which we have investigated up to now have not shown any serious complications. So there is no need to panic. There is no need to rush to a hospital. But be in touch with your doctor and remain at home, isolate yourself, and just maintain good hygiene so that you don't infect others. That's all.
Right. So, last time around there was always, this number which people were talking about that if your oxygen falls below 92, 91, you may need to rush to hospital to take oxygen. When should you start to panic? What is the number that, one has to look at before they go to the hospital, or they should know that, now it's the time that they probably need advanced treatment?
See, basically the same parameters hold even now. So if the oxygenation falls below 90, you need to go to the hospital because there is a very high chance that you may be still having the Delta strain. This Omicron strain, which is currently happening, does not affect the lungs that much. And the saturation is remaining stable even in octogenarians. Like we have had people who are 80 plus who have got this disease and they have got fever, they got cough, but their oxygenations have not dropped. So it's not that this particular wave is creating that kind of situation. But yes, if it does drop, you have to go to the hospital. And that remains the same. Otherwise, you can safely remain isolated at home and be treated at home itself. There is no need to panic. This particular disease is a much milder form, but it's very highly transmissible. So, if one gets it, if proper hygiene is not maintained, others in the family also are very likely to get affected, whether you are vaccinated or not vaccinated. Or even if you have had a COVID infection earlier, you can still get it. So this particular wave does not get any immunity from your past infections. So that you have to be very careful. But oxygenation, yes, you must monitor because prevention is always better than a panic attack later on.
Right. In terms of retesting, what will be the protocol in the current phase? When should you get retested after you know you've got COVID?
Uh, Retesting is strictly not necessary because once you get are turned positive, this particular wave generally by around fourth day the symptoms start going waning back. Seventh day onwards, even the government is saying if you are asymptomatic, you need not get tested. 10 days of isolation and you can be back to work. In fact, the government has advocated 7 days for healthcare workers because, as you see, the doctors and the nursing and the other back-end staff of the hospital, they are also falling sick by rapidly because of this high transmission rate. So 7 days of isolation for healthcare workers if they're asymptomatic is what is being mandated by the government also. There's no need to retest at this junction. After 10 days, you can, if you're asymptomatic, after 10 days, you can resume your activities.
Next. Right, Doctor. This is Cheryl also joining in the conversation. We all know that our children of the younger age are yet to be vaccinated. Nothing has
I'm
been
sorry, I'm not.
decided yet on when they will be vaccinated. And I'm talking about basically from the toddler age group. Given that they are also highly likely to be infected in this COVID wave, knowing that it is highly infectious. What are you seeing any rise in cases on that particular front, given
Yes,
that
the
your
children are
hospital
also
is
getting
also known
affected
as one
by
of the
it
best pediatric hospitals?
in numbers. See, Surya is basically a children's hospital, so we get a lot of kids coming here with the same symptoms which the adults are getting. We are getting children with fever, with cough, and when they are tested, they are testing positive. But the disease is behaving in the same manner. It's like any other disease. It's just get symptomatic treatment, give them comfort at home, and they are fine. The need for hospitalization is only required in children who the fever tends, so in some children the fever tends to go very high, and because of which they get a convulsion. So those kind of the children are the only ones who require hospitalization. Rest all can be treated like a normal cough cold fever patient child at home, and the child will be all right. But yes, you have to be in touch with your pediatrician because monitoring is important. Don't self-medicate and don't remain like an ostrich with the head buried in the sand. You have to show a doctor and take treatment.
Absolutely, like you said, you have to show to the doctor, avoid self-medication. So, what are the symptoms when it comes to children that one should really take care of? Because you know the flu season is also in, and most of them are saying the Omicron variant, the symptoms are similar to that of the flu. So, how do you differentiate? When do you know that you need to
For
test when it
testing.
comes to children?
It's difficult to test, I agree, but it's always safer to test. And rather than see, because the treatment is not going to change. The same treatment which you're going to give to the child for flu, we are going to give it for the COVID also. There are no other special medications available here, any which. So, in this particular situation, the only thing is if you know about it, you need to isolate them more because of this children can transmit it to the seniors in the house. That's the only reason. That's the other thing. And like I said, the fever needs to be controlled because if the fever rises very high, the children, especially the below 5 years of age, tend to have a convulsion. So that's the only reason why we need to control the fever very well. And that's the reason why any flu fever, flu symptoms, please consult a pediatrician. It's very important.
Thank you so much, Dr. Ambegaokar, for joining us on the show, giving us your take on what should actually people do, what should be the first step when, in case if you think that you are COVID positive, and what are the precautions that you need to take when it comes to children, especially that they are yet to be vaccinated. That was Dr. Hiren Ambegaokar, who is the Group CEO of Surya Hospitals.